So this is the console for the Dynatron lumbar traction unit in lab. This is the newer traction unit. To turn on the traction unit, you would press the power button on here. You can see that you are able to set the rest time on the left and the hold time on the right. There's these arrows that show you, when it releases the pressure and when it pulls. So you use these arrows to set the number of seconds of rest time and the number of seconds of traction time. These dials below here will allow you to set the force. The button on the left will read the force here, the minimum pull or the rest pull, and the button on the right will help set the maximum pull. The thing to know about this unit is as you dial upwards to set the amount of pounds of pull, once you stop moving the dial, it takes about 2 seconds. Then this traction force number will change from the maximum limit or the minimum limit you set back down to 0. And that lets you know that the unit accepted your information. You set the time by toggling up and down the treatment time. And again, for the skill check, you'll be looking at somewhere between 8 to 10 minutes for an acute case or 20 to 25 minutes for a chronic case. Make sure the patient has their emergency call bell and then hit start. The button on the far left above the power button is the speed button, and that's kind of a more fluid ramp time. So you can have it be a slow pull or a fast pull. For the purposes of this examination, because we want to be conservative, you're going to want that speed to be set at low. So just a brief review of the Dynatron traction unit for how to set parameters for lumbar traction.